we have the anterior fontanel, the posterior. Then there are about 2 mastoid and 2 sphenoidal. So I'm not going to
just words.
But the one people are really familiar with is the front one. So the anterior one, we call it anterior fontanel. It's normal. It's a normal phenomenon in babies. It's actually a soft spot, like most people will call it, to allow like an easy passage for a baby through the birth canal, and also to allow for expansion, like for brain expansion, for brain development. Yes. When a baby is growing, the posterior one closes earlier than the anterior one. So people don't even know about the posterior one. They are not aware most of the time because it closes between 4 to 8 weeks in babies. But the anterior one closes around 18 months.
Over a year.
Over a year, yes. Some 2 years, that's 24 months. But there's some abnormalities in which case it will not close. And the baby will have it till like 4 years,
Okay, but eventually it closes.
It closes with intervention, like after seeking medical intervention.
So if I'm to infer from what you just explained now, that means fontanel is totally normal.
It's normal.
So when does it become worse and when should we be worried about it?
Okay, like first when it's sunken, like you said, like the topic we are discussing today, it's not meant to be sunken. The ideal anatomy is that it's there's a slight inward curve, which is normal. So, but when it becomes too depressed, that is worrisome, and it calls for medical emergency. Like a mother should seek medical intervention the moment it becomes too deep. And also when it bulges, like when it's, like I said, the anatomy is a slight depression. So when it's bulging,
that's coming out.
Also, the mother should seek a pediatrician help.
So it's either when it's depressed or it's bulging.
So what can lead to it to get sunken and also to bulge?
Basically, like when it's overly depressed, it can either be due to dehydration. Dehydration means the baby has lost a lot of water, through the system, either through passing out too much urine or vomiting, or through diarrhea, passing watery stools. So in that way, the baby can become dehydrated. So in a state of dehydration, it will be depressed, to be overly depressed. Then in a state of malnutrition, like a baby that is not well fed, that has kwashiorkor, that have marasmus, they can have a depressed anterior fontanel. Also, there's something called failure to thrive in a baby. Like as a pediatrician, to assess a baby's growth, you use certain parameters. We call them anthropometry, whereby you check the weight, the height, the BMI, the BMI,
circumference, head circumference.
So when all those things are falling below a certain graph, there's a chart that they're supposed to follow as a trend, to say that this baby is actually growing, So there's a 3rd percentile, which is the least. There's a 97th percentile, which is the highest, on that scale. So when a baby is falling below the 3rd percentile, we say the baby is failing to thrive. So in such scenario, the baby will have a depressed fontanel. And also there's another one called toxic megacolon. I'm not going to bore you with.
Toxic megacolon.
Yes, that's a big one. Like it's a medical condition in which the colon, we have the small one, we have the big one.
Yes, within your GIT.
The big one is abnormally dilated. So it's as if you're just pouring water into like a well. So the baby is not getting enough. So it will still lead to like a malnourished baby, failing to thrive baby, and at the end of the day, the fontanel will be depressed further. Then lastly, there's something called diabetes insipidus. It's different from diabetes mellitus. Diabetes insipidus is when the kidneys cannot reabsorb water the way they should. Like you take in water, you're supposed to excrete some through urine. So these kidneys are just failing to do their work. So they're not They're just passing out all the fluid
everything.
as taken in. And they're passing out even the ones that you've not taken in. They're just passing out all the fluid. So the person will become dehydrated and the anterior fontanel would
sink
be
in.
deep in. Yeah, it will sink in.
But, you know, I'm still trying to understand the dehydration in babies. I know you breastfeed them.
Yes.
So how come they get dehydrated?
Oh,
Is
they
it like
can
a condition?
Get, yes, it's a condition. It's
Okay.
a really terrible condition because dehydration in babies means that first thing first, if the baby is not taking in enough from breast milk, like you said, and this happens a lot in first-time mothers, for instance. They just feel that, okay, this baby has been sleeping all day. Why should I wake the baby? Why should I bother the baby? They just leave the baby. The baby does not have enough meals, you know, like...
Okay.
For instance, if the baby is on admission, you feed, there's a way you feed, depending if they are preterms, if they are term babies, you feed maybe 2 hourly, 3 hourly. But a first-time mother can just, hey, the baby is sleeping. I don't want to wake the baby, let me allow the baby sleep. So it can happen as a result of, first, inadequate intake. Baby is not taking enough. Or in a disease state in which maybe the baby is chilling, is vomiting, the baby will get dehydrated.
Okay.
And ideally, when a baby is chilling and vomiting, you're supposed to replace. So if you don't replace as much as is being passed out,
There'll
baby
be an
will
imbalance.
get, yes, there's an imbalance. Baby will get dehydrated. You know, there are some illnesses, like the baby will be running fever. We call them sepsis, like fever. Some people will just assume, okay, this is Nigeria. Malaria is endemic. They give anti-malaria, and this baby does not get better. But instead of them to take the baby to a hospital, they just give the baby, you know, doing other things, giving paracetamol. The duration at which the baby gets, you know, like to stay at home for prolonged illness, the baby can actually get dehydrated as well. So
That's amazing. Okay, so aside dehydration, what else?
that can cause
Yes, it to be sunken.
malnutrition,
Okay.
like imbalance.
Okay.
You know, from the word nutrition is nutrition, like
Yes.
feeding.
Yeah, you're not
Yes.
getting
Malnutrition, like, is either too bad, you know, like either, and it can go either way. Like
enough. Either too high or too low.
too low.
Yes.
Okay.
You know, some mothers, for whatever reasons, might not want to breastfeed their babies.
The babies.
I don't know, for whatever reasons. Like, some will say maybe conveniency, they're going to start work, they're going to do this. They're going to
Probably
What
do
some
about
just
babies?
don't
There are some babies that stop taking breast milk.
Yeah,
What
Yes,
to those
some
ones?
babies actually do.
Yes, I've had a lot of people saying maybe breast milk is actually the best, and a baby that is exposed to breast milk would not want to take anything else. I mean, so when mothers come and they say the baby stop, so when you give the baby formula, the baby takes formula. I mean, it's strange. It's like taking jollof rice and you want to come and give me beans, porridge beans.
True,
But
that's
they
true.
still come with such stories. This baby stopped breastfeeding, and so such mothers, for instance, they can decide to give their baby formula, and there's a way to, you know, like preparing this formula, you know, and if you pick a tin of milk, it will be stated there, 1
Yes.
scoop
Yes.
to 30 mils.
Of water, yeah.
So if they are not doing
In the right way.
the right way, they can just give their baby dehydration. You know, baby, like if they are giving 2 scoops to 30 mils, the baby will become dehydrated because that concentration is not good for the baby. The baby can just start passing out stools and will become
Does that mean that
dehydrated.
dehydration is like one of the main causes
Causes.
Yes.
of sunken
Yes.
fontanel?
Yes.
Okay.
Malnutrition and dehydration.
Dehydration. Okay.
Through vomiting and stooling.
Okay.
Yes.
Okay.
So when does this condition become noticeable in a child?
Okay, like it's actually obvious, you know, like the place is a soft spot. It's triangular, is at the center, almost at the center of the head. Most people are aware of it because at times it pulsates, you know. So when you rub your hand on it, it's supposed to be at the same level with the bones, with the bone of the skull. So when it's sunken, because that area is devoid of bone. So when it's sunken, you actually see a depression.
Wow.
You'd see a depression. You see an obvious depression. And when you see that, the ideal thing is to take the baby to a hospital.
Okay,
You know.
what I mean is that Is it that there is a possibility of you noticing that in your child of, say, 6 weeks, 8 months? When is there a particular time that it can come on, or it can be noticeable as early as 1 week?
Okay, we have an example on a picture.
Yeah.
Yes. So something like that.
Something like that. Okay, what that picture is showing, like a depression, like less than half a centimeter.
Okay.
So that is the normal one. But when you can actually dip maybe about 2 cm of your hand in, that's an issue. That's not nice. Yes.
So basically, you can notice
and you can notice it anytime. Like we can notice it as early as 1 week, 2 weeks, and on till it closes. It closes at 18 months, so you can notice it from 1 week till it
okay.
closes.
So from when you start noticing it, you're meant to go to the clinic for medical intervention.
Yes, that is the idea. That is not to say that some individuals, some babies, they have slightly depressed fontanel.
Okay.
And they're perfectly well. They're normal. There's nothing wrong with them. You know. So some people can have a normal variant of depression. It's okay. It's perfect.
Okay.
Can we have a case where it never closes?
Yes.
What will cause
till
that?
Adulthood?
Till adult, when you are grown.
Yeah, have you heard of hydrocephalus?
Yes, that's water in the brain.
Water in the brain. Those people with big brains, like not big brain, big head.
Yes.
You know, and till they grow old, adulthood, it will remain like that because the bones will never come together.
And is that due to maybe lack of not going to the hospital
on time?
The hydrocephalus?
Hydrocephalus is another condition.
But it stems from sunken fontanel?
No, it's like the fontanel is there. It's not sunken.
Okay.
Their own is just permanently opened, like
yes.
you said. Like, you know, I told you that the anterior one is meant to close at 18 months to 24 months.
Yeah, compared to the one
at the back.
Okay.
So the situation where it will never close includes hydrocephalus, rickets, head chondroplasia.
What's that?
Those people they're like dwarf, they're thick, you know.
Okay.
I don't know the layman term for them.
Okay.
But they're not too tall.
Tall, yes.
They have a big head. They're stout, thick body.
Those physicals.
Okay.
I was going to ask a question still concerning sunken fontanel.
Okay.
Does it present with symptoms aside the depression, the physical depression?
Yes, depending on the cause.
Okay.
If the cause is due to dehydration, there will be other signs of dehydration. For instance, the eyes will be sunken as well.
Okay.
I mean, like you can practically see the sockets, the balls, you know, going inside the socket. Then the baby will have a dry mucosa. The lips will be dry. The tongue will not be as wet as it should be. You know, they can have all signs of dehydration in addition to that.
Okay.
If it is due to dehydration. If it is due to malnutrition, you will see other signs. Like the baby can have flaky paint, what we call flaky paint dermatitis. The skin will be peeling, the hair will be brownish, black, you know, like we call it flag sign, where you see a patch of black layer, the brown on top, then another black, you know.
Wow.
So like a flag, Nigerian flag, green, white, green.
That's not fair.
So we call it flag sign.
Okay.
You know, so it can actually happen. So depending on the cause, you see other signs.
Other signs.
Like if a baby is, for instance, if a baby is 1 year old, they're meant to weigh 10 kg. And the baby comes to me and I see 5 kg. So I'll know that this baby is not thriving.
Yes.
Then I will expect the anterior fontanel to be sunken. If it's not sunken, then I have to look for it. You know, like, why is it not sunken? Are there other things? You know, like that.
Okay, so let's dive right into myth, fallacy, and stereotypes concerning this. Of course, it's a very juicy one. Now, for some people, the traditional way of them curing this is by turning the baby's head
Upside
like
down.
literally hanging the baby like a balance. I know normally that cannot sound good, but
Yes, I actually see some mothers do it.
Yes.
Like they...
It's a no-no. It's a no-no. Really, I don't know what works in the past, but thank God for enlightenment. Enlightenment is not acceptable. You know, like all those things that grannies used to do for babies, you know, when they come to, you know, help nurse a baby, is actually half of them are not right medically.
Okay.
You know, I don't know why they do that. Maybe they want to do that so that it will become full. But what happens when you turn the baby back? I mean,
actually, I'll have to cut you right short now because we need to go on a break. This is something I really want to hear a lot about, and I'm sure a lot of them too want to hear it. So we're going on a quick break now.
You can join us tomorrow for another exciting episode of Tea or Coffee.